Hi, my name is KOsburn. I'm an EKU MSN student. I'm a registered nurse on a post-cardiac intervention floor where we frequently treat congestive heart failure patients experiencing an exacerbation. Congestive heart failure is a widespread chronic illness affecting approximately 65 million people in America. The chronic disease is estimated to cost the United States healthcare system $38 billion per year. As improvements in healthcare are made and underlying treatments of heart failure are better managed, heart failure diagnosis will continue to rise. It is estimated that an additional 555,000 diagnoses of heart failure will be made each year. The purpose of this project is to implement more routine primary care follow-up for congestive heart failure patients to better manage their symptoms with the ultimate goal of improving their quality of life. The targeted patient population will be congestive heart failure patients hospitalized with an acute exacerbation. 2 cardiologists and the patient's primary care providers will also be targeted for participation in this project. An extensive literature review was conducted of 8 research studies in which each study found better patient outcomes associated with congestive heart failure patients routinely visiting their primary care provider. The proposed intervention begins with developing a relationship with 2 cardiologists at a local hospital, Baptist Health Lexington. The 2 cardiologists will be asked to participate and then refer a total of 20 hospitalized congestive heart failure patients for participation. The chosen patients will be asked for permission to participate and will be excluded if they are under the age of 18 years or if they have a terminal diagnosis. At discharge, the cardiologist will write for an order to follow up with the primary care provider within 2 weeks. The primary care provider will be contacted by the primary investigator for participation, so that the patient's quality of life can be assessed at the initial primary care visit. The principal investigator will administer the Minnesota Living with Heart Failure questionnaire at the primary care provider's office or via telephone at the first visit. The patient will continue to follow up with their primary care provider once a month for a period of time of 1 year. At each of these 1-month visits, the quality of life will be assessed by the primary investigator either in the office or via telephone. The Minnesota Living with Heart Failure questionnaire is the most widely used tool in assessing quality of life. A study conducted to measure the measurement model of the Minnesota Living with Heart Failure questionnaire found its reliability coefficient to be 0.9 for almost all physical and total scores. The participants will continue to follow up with their cardiologist as usual with no changes related to this intervention. The patient's quality of life scores will be trended over the time period of 1 year to monitor for improvement. The score will be put into a graph to determine if the intervention is appropriate for further implementation. This will be determined by a p-value greater than 0.5. Confidentiality will be maintained through signed contract and the use of computers for data storage that are logged. The aim of this proposed study is to ultimately improve the quality of life in heart failure patients by the frequent primary care provider follow-up and utilization of all healthcare providers for the project. Thanks for taking the time to listen to my project proposal, and hopefully we can improve patients with chronic illnesses' quality of life.